Well, these are great topics. And I guess, right from the start, as we think about the patients speaking, if we had a chance to talk to a patient that you're serving, what is their biggest need? What is their problem? Or, sometimes we say gap. What is it that the patients need in this area of precision medicine?
That's a great question, and we can probably spend an hour on just that. I think what I'll preface it with is that we're at an incredible point in history, and modern medicine is going to advance more in the next 10 years than the last, call it 50 years combined, is the consensus. Now, why is that going to happen? It's because of the advancements and the convergence of technologies that you mentioned, artificial intelligence, precision medicine, genomics, more data, and higher compute capacity to process that data. And that data, by the way, is absolutely useless if you cannot collect it, clean it, refine it, and then produce an outcome, right? So all the Fitbits people wear and Apple Watches and other sensors collects a ton of data, and it's a gold mine, but you got to be able to mine it to unlock that value. Now, if you're going to, as the oncologists say, increase the PFS and the OS, the progression-free survival or the overall survival of the patient, it's all about better detection, treatment, and monitoring, so DTM. And where we come in on the CureMetric side is the detection, where it's our women's health suite, where we detect breast cancer and heart disease from the same mammogram. No extra radiation, no extra discomfort. And we could definitely delve into that, because early detection is, we all know, it's so critical, whether it's colon cancer or heart disease or breast cancer or diabetes. It's just so important to know as early as possible. So imagine if a woman at the age of 40 goes in for her first mammogram, she's skinny, she's fit, she exercises, doesn't have family history of heart disease, and they tell her you have breast arterial calcification, and now she can go to a cardiologist, know that she has that condition, get on statins earlier. And again, just getting on the statins reduces the risk of a cardiac event by 50 to 60%. So that knowledge is power, and that'll add decades of life to that individual. On the cure match side, it's for patients that already have cancer, and it's not just women's health, it's pan cancer, so any cancer for man, woman, or child. And that's where, again, every cancer being different, as Dr. Kurzrock says, cancer like a snowflake, no two snowflakes ever look the same. And so to truly deliver the best optimal combination, it's got to be based on that patient's specific molecular profile of their cancer. And so other companies and labs will do the biopsy and sequencing of that and produce their report, which is called the NGS report, a next generation sequencing report. To the layperson, I say that's like the 23andMe of their specific cancer. And that's our input. We take that in to then say, out of the 4.5 million combinations of drugs, here's the best combination, 1, 2, 3 for this specific patient, as our decision support report for the oncologist to then review with the patient in the care of that of their situation and their cancer.